Welcome to Stroke Day Awareness Program, where we dive deep into understanding what stroke is, its prevention, and recovery. So today, we'll share vital information about stroke and that could save a life and empower you with the knowledge of early recognition of stroke. Joining our discussion today is Dr. Komal Kumar, Senior Consultant Neurologist and Stroke Care Physician from Yashoda Hospitals, Secunderabad. Welcome to the program, Doctor.
Thank you.
So let's begin by understanding what exactly is stroke and how it affects us.
First, we have to understand that stroke is related to brain. So there is a misconception among people that the stroke is related to heart attacks. Stroke is different, heart attack is different. Whenever somebody says stroke, it is a disease of the brain in which your brain or eye or spinal cord, so there will be temporary or permanent lack of blood supply and then they suffer. So with resulting in symptoms like blindness or weakness of one half of the body, slurring of speech or loss of speech, difficulty in walking, loss of balance, and sometimes they can have weakness of both lower limbs also if they have problem with the spinal cord. So this is a stroke. And then again I am emphasizing that stroke and heart attack both are totally different. And stroke is rising globally because of the increased population, aging population. And stroke is not just a disease of elderly people or very aged people. It is a disease which can affect across all age groups. See, we see patients with stroke even at very young age, including newborns also. But though the reasons or causes are different. And especially in Asians, there is a condition called Moya disease, especially in Asian population, like Japanese, Chinese, and in Indian patients also, where there will be progressive narrowing of the blood vessels inside the brain. So it is partly thought to be because of genetic and because of the various other factors. And it is not an uncommon disease in adults also. So this is very, very important. So stroke, the thing is, it can occur across any age group, and no age is immune to stroke.
I think you made a very important point by saying that stroke is no longer associated only with an elderly age group population. So when we talk about stroke, we emphasize that time is brain. So what is the importance of early recognition and what are the common symptoms that we usually see?
So this is a very good question. Stroke, see, we have human brain is an enigmatic structure. It is made up of billions of neurons, billions and billions of neurons. And they are active throughout. See, when you are sleeping also, your brain is active. And each neuron has connections with 20,000 different neurons. See, imagine this, 7 billion neurons and each neuron having connection to 20,000 other neurons. And all these neurons should work together. And then they need constant blood supply. In fact, we have a cardiac cycle where heart pumps blood into different parts of the body. So that is systole and diastole, where heart pumps blood and then after that heart relaxes. So pumping phase is called systole, relaxing phase is called diastole. Most of the organs in our body, they just need blood supply during only systole. This is during pumping phase. But brain and kidneys are the only organs which need blood supply during systole and diastole. That means they need continuous blood supply. Because kidneys, they do filtration. So these are the two organs which need blood supply throughout the cardiac cycle. So any cutoff of the blood supply or any temporary loss or permanent loss of the blood supply to the brain can result in ischemia or damage to the neurons, resulting various symptoms, which is often called as stroke.
So when someone is having a stroke, what are the early interventions that we do to prevent further damage to the brain, doctor?
The most important thing in stroke is recognition of stroke. See, if somebody has sudden onset of slurred speech, or weakness of one side of the body, difficulty in walking, or double vision, or loss of vision, or difficulty in understanding speech, or difficulty in communicating, we have to suspect the patient might have suffered a stroke. And time is brain. See, each minute, the patient, if the brain doesn't get blood supply, 7 million neurons are at risk. So we should spot the stroke immediately and then we should take the patient to the nearest stroke center. And then most importantly, what we do is we do a CT scan and see whether there is any bleed or infarct. See, stroke can be because of the blockage of the blood vessels, which we call as ischemic stroke, or it can be because of the rupture of the blood vessels, which we call as hemorrhagic stroke. Ischemic stroke accounts for almost 60 to 70% of the cases. So whenever there is a blockage of the blood supply, we do a CT scan, and then we rule out a bleed in the brain, and then we give a drug called clot buster. So where we give a drug, if given properly, within first 4.5 hours of stroke, is known to cause disintegration of the blood clot and opens up the blocked blood vessel. So thereby we can restore the blood supply to the brain, and then we can reduce a lot of disability. We can save many neurons.
So discussing about stroke and its treatment, doctor, what is stroke care pathway that we follow here?
Once a patient arrives at the hospital, then when we suspect stroke, most important thing is we draw a blood sugar. See, low blood sugar also can mimic a stroke. So we confirm or rule out low blood sugar, and then we do a CT scan immediately. And when the bleed is ruled out, we give a drug called thrombolytic drug. Then where we can push in, when the patient comes out of the CT scan table. And once we push in the drug, we again do a CT angio, where we look at the blood vessels from heart up to the brain. So we cover the blood vessels again from the heart, and then the neck, and then all the way up to the brain. And if there are any major occlusions, we do not wait for the drug to act. So this is the latest trends, where we shift the patient immediately to the cath lab, where an international radiologist, an expert in stroke intervention, will put a guide wire into the occluded blood vessel and remove the clot, thereby restoring the blood flow. And world over, the studies have been shown very emphatically that patients who have received both thrombolytic care as well as mechanical thrombectomy, where we pull out the blood clot inside the occluded vessel, have done better in patients with large vessel occlusions.
So what are the benefits that a patient would be having if he or she undergoes mechanical thrombectomy, as you have mentioned?
As I said earlier, each minute we lose millions and millions of neurons. Whenever there is a stroke, there is what we call in the pathology, there is a central core. Means the neurons at the center are affected, means damaged permanently. But there are a lot of neurons which surround that core, which are at risk. Means they are not completely damaged, but because of the reduced blood supply, they become dormant. So by restoring this blood supply, we are saving those many neurons actually which are at risk of damaging further. So this is the crux of stroke care. And by doing that, so we can reduce disability. See, the thing is, stroke is one of the major cause for disability among the people. Another important thing is it affects people at the prime of their life. See, it usually affects between 40 to 60 years of age, commonest age group. The thing is, see, these patients are at the prime of their life, at their productive best. So by striking at that age, so not only the patient is get affected, the family members, the caregivers, everybody will be affected, both financially, mentally.
So discussing about stroke, doctor, though it's a very common condition that we see across, but the awareness about it is still very scant. So I'm sure there are many myths surrounding this. The first one especially is once you're affected with stroke, it's nearly impossible to get back to your previous life, what it was. So how would you like to correct this?
See, the stroke, once the acute care is over, it is a myth actually that once a stroke strikes, patient will not get any improvement after that. So it's a myth actually. If a patient is given a thrombolytic drug, ischemic stroke, and others there is large vessel aggression, you do thrombectomy and open up the blood vessel and restore the blood supply to the brain. So studies have shown very clearly that most of the times these patients do extremely well at the end of 3 months, 6 months and 1 year. There are instances where patients have regained their functions totally normally. So they have become totally normal as they were before the stroke. Another myth is that the improvement after the stroke occurs up to 6 months only, and then after that improvement will stop or it will slow down. Most important point which I want to emphasize is the improvement in stroke occurs lifelong. Okay, it is not that it can happen after the end of 2 years, 3 years, 4 years also. And especially some people suffer with stroke, and then they have this loss of speech. This is what we call aphasia. And studies have shown that patients with aphasia, the improvement of speech and language is better after 6 months of stroke than the first 6 months of stroke. And many new medicines also have come for that.
So doctor, as you said, that stroke can affect anybody irrespective of their age or gender. So are there any preventive measures that you would like for us to follow?
Yes. See, the most common important risk factor for stroke, they are modifiable and non-modifiable. Non-modifiable is the age. Age itself is a risk factor for stroke. The older you become, more is the risk for a stroke. And modifiable risk factors, the most common are hypertension, that is high blood pressure, and diabetes, and then high cholesterol levels, and smoking, sedentary lifestyle. So these are the modifiable risk factors. So control your blood pressure, do regular exercise, cut down your sugars, and then high lipids, and then control your diabetes. So by doing all these things, you can reduce the stroke risk substantially.
So with the years of experience, especially in stroke care, what advancements have you seen, especially in this area, doctor?
Actually, stroke, there are a lot of recent advancements in stroke. Previously, in early 90s, and then whenever a patient comes with stroke, there would be a nihilistic approach. But in 1993, so there's a trial called NINDS trial, in which they have shown that patients with ischemic stroke, that is, a stroke in which there is a blockage of the blood vessel, this thrombolytic therapy can do wonders. Then came into the early 2010 to 2014-15, again, which studies have shown that patients with ischemic stroke who have undergone mechanical thrombectomy, again, to fare better than patients who did not undergo mechanical thrombectomy. And we can do this mechanical thrombectomy in most of the patients up to 6 hours after the onset of the stroke. But in selected population, we can extend this time period up to 24 hours also. But in highly selected patients, we can do up to 48 hours also.
So thank you, doctor. It was wonderful interacting with you, and thank you for letting us know what stroke and its importance is. So before we wrap this episode, is there any message that you would like to share with the audience?
See, stroke is again a common disease. It is a disease of the brain. It's not the disease of the heart. And it can occur at any age group. People with hypertension, diabetes, smoking, sedentary lifestyle, and dyslipidemia, that is high cholesterol levels, are at risk of stroke. So take care of your blood pressure, hypertension, do regular exercises, and then control your blood sugars, and do active exercise, and quit smoking to reduce the risk of stroke.
So this brings us to the end of this episode. Remember, the goal of World Stroke Day is to increase awareness, promote prevention, and highlight the importance of early recognition and intervention. We hope this episode was both inspiring and informative, and stay tuned for more informative episodes. Until then, take care and stay healthy. Thank you.